In today's video, we're going to be going over pharmacodynamics and helping you to better understand what this topic means in a way that's simpler and easier for you to understand. So if this is something you want to know, make sure you go ahead and stick all the way to the very end of this video. And as always, make sure you go ahead and check in the description below for our free resources, our pharmacology guide that you can download for free right now so that we can learn more about pharmacology in a lot more detail. So make sure to download before the video. So have you ever wondered what medicine or what drugs actually do to the body? This is what pharmacodynamics is all about. So it's basically the science of how drugs cause effects once they're in the body. So by the end of the video, you'll understand the basics in a way that's hopefully easier for you to remember. So pharmacodynamics, this is what the drug actually does to the body. So you can compare this. I did another video recently where I talked about pharmacokinetics. So with pharmacokinetics, that one is what the body does to the drug. So that's where how the body will cause the drug to be absorbed, how it breaks it down and gets rid of it. But pharmacodynamics, you have to think of this as like the action part. So this is what the drug, how the drug affects the body, not how the body affects the drug. All right, hopefully that makes sense. So that's what pharmacodynamics is all about. So let's go into it. So drugs, what they do they usually work by attaching to special spots on or inside the cells called receptors. So receptors are kind of like locks and drugs are like the keys. So think of types of receptors, like for example, there's ion channels. These open and close doors for ions like calcium and sodium. There's G protein coupled receptors. These are common ones that send signals like adrenaline. There's enzyme linked control things. Well, there's enzyme linked, which is where they control things like blood sugar, like insulin. And then there's inside the cell, which is like steroid hormones that go straight to the nucleus. So, for example, morphine will find opioid receptors that will tell the brain less pain. Right? Isn't that powerful? So, think of the next thing you want to think of now is agonists and antagonists. So, agonist activates the receptor, which is like a key that turns the lock. So a drug can be an agonist or it can be an antagonist. So if it's an agonist, it's going to, so to speak, unlock that key, right? And then if it's antagonist, it's going to block. And the key fits, but it doesn't turn. And then you have a partial agonist, which is only half turned to lock, for example. So morphine is what we call an agonist. It turns pain off, right? So that means so essentially when the drug goes into the body, right? When somebody swallows or takes and consumes medication, it goes and finds the opioid receptors and it will work as an agonist to turn pain off. But naloxone is an antagonist. So naloxone will block morphine to reduce overdose. So naloxone is like the antidote, so to speak, for opioids or too much opioids in the system. And it will go and it will block the morphine from attaching to the receptor sites. That's the difference. So agonists, they turn on, right? They turn like a key to a lock. Antagonists block. And then partial agonist is like it only is in the sense it only half turns the lock. So when it comes to drug, you have to think of it where the more drug that we give, the bigger the effect, right? Up to a limit because then it's going to be dangerous. So the more drug we give, the bigger effect. So there's two ideas here. We have potency, which equals how strong the drug is at a small dose, right? So you know how with some medications you can give a very tiny amount, but it's like it works wonders, like Ativan, for example. And then other drugs where you have to give a lot before the patient actually feels it. So potency is how strong the drug is at a small dose. versus efficacy is the biggest effect the drug can give, right? The biggest effect the drug can give. So efficacy would be, for example, if I give a medication and my goal is to stop the patient's pain, but the biggest effect it could have is that it could stop their pain so much where they go into respiratory depression and you can't wake them up, you know? So morphine works at a small dose, which makes it very potent, and it gives a strong pain relief, high efficacy. Codeine, though, codeine is, not as effective, and so patients need a bigger dose, and it isn't as strong. All right. So you have to remember potency versus efficacy. Then we have safety risk. All right. So every drug has a safe range, or what we call a therapeutic window. So if you give, for example, if you give too little, it has no effect. But if you give too much, it's toxic, right? So for example, penicillin, it has a very wide safety window. So meaning that it's hard to overdose when it comes to giving the patient penicillin. So you could give the patient a ton of penicillin, so to speak, and it has a wide safety window. So it's hard for it to be for it to reach toxic levels in their system. But versus digoxin has a very narrow window, so it's very easy to overdose. So that's why with digoxin, we have to check their digoxin levels prior to giving it. We have to check their heart rate prior to giving it, and after giving it as well, because it has a very narrow window. It's very easy to overdose. So there's a reason, though, why patients respond differently. So not everyone's going to react the same, like I talked about in the previous video. There's different reasons that causes somebody to react differently. So, for example, we have genetics, age, weight, if they have other diseases, right? So, for example, I could give a patient 1 milligram of Ativan, and because that patient is like, let's say they are bigger, let's say they're very healthy, and the 1 milligram Ativan does absolutely nothing to them. But then I could give the same 1 milligram of Ativan to an elderly patient or a really petite patient, and that Ativan, they're out for like, a day, So other drugs at the same time as well also affects how it interacts with the patient's system. So that's going to be interaction. So for example, if you have a patient that's drinking alcohol and they're taking sleeping pills, that's a horrible combination, and they actually work to make each other stronger. So the patient could go into severe depression because alcohol is a depressant, and sleeping pills are also depressant. So that's gonna be dangerous for the patient. An easy way to remember this is think of an acronym called RAD. All right, RAD. So R stands for receptors, which is where the drugs work. So the receptor sites, right, and where the cells are, that's where the drugs begin to do its work. That's where the effect begins to take place. Agonist versus antagonist is what that type of drug does. So once again, agonist, it turns on, versus antagonist, it's blocking, right? So, and then D, dose. Dose is going to do with response. So how much drug equals how big of an effect? How much drug equals how big of an effect, right? So once again, you could give a patient the same, like a drug, which we talk about potency and efficacy, right? You could give a patient a drug, and because they have other genetics or other diseases, that drug, they may respond to it differently, as opposed to somebody else, it may not do anything for them, or it may be extremely therapeutic and achieve the results it's supposed to achieve, right? So a simple way to remember the general concept of pharmacodynamics is to think of RAD. R, receptors, is where the drugs begin to do its work, right? So there's receptor sites everywhere, all across the body, brain, everywhere, right? All throughout the cells, throughout the body. But that's where the drugs work. And then A, agonist versus antagonist, and then D, dose, which is the response of how much the drug is to how big of an effect it is. All right. So in short, hopefully you found this video helpful. You may need to listen to it multiple times for it to really click and make more sense. But I hope that you found it helpful. Keep all these things in mind. Check out the below. I do have some resources that goes over pharmacology and nursing and different type of topics. And make sure you hit the subscribe button. And thank you for tuning in.